Assalamu alaikum. Mr. Moderator, our distinguished guests, brothers and sisters, our friends and our enemies.
Bismillah wa salatu wa salam Rasulullah wa ba'd. So we have a very, very special guest today, Dr. Sulaiman Tijani. كيف حالك؟
بخير الحمد لله.
Alhamdulillah. It's a really big honor to have you on my channel. Excuse me. I'm very honored, very, very happy. We're going to discuss some very important topics concerning the coronavirus. And before we start, I just want you to tell a little bit about yourself first.
Inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. So firstly, let me thank you for inviting me on. Given what's going on everywhere, I think it's important for us to have this discussion. So as I said, my name is Sulaiman Tijani. I'm practicing medicine. I'm a medical doctor essentially in New York City. We know how it was hit significantly. It was an epicenter for the recent outbreak pandemic. I'm from Nigeria, and I did my medical training in Jamaica. And then thereafter, I came here for residency training. So alhamdulillah, I just completed my residency in internal medicine, and I'm going to be furthering my training in pulmonary and critical care medicine. So that's where I'm going to be going on to next, inshallah. So may Allah make it easy for you, for me, for all of us in all our endeavors.
Ameen. Right. So the reason why I invited you on the show is because you're a frontliner. You are actually on the front lines of this whole coronavirus. And there is a ridiculous amount of misinformation concerning the pandemic out there, particularly in the Black community. So like, I'm just a simple guy. If I want to find out the truth, I'm going to go directly to someone like you, right, who's on the front lines to see if this is real or not. So can you please tell us some of your experiences about the coronavirus? First of all, is the coronavirus real or not?
All right. So I think one of the most important things for us to understand is, many of us would have grown reading Sherlock Holmes, right? You know about Sherlock Holmes?
Yes.
And the one who wrote it, Sir Arthur Conan Doyle, he's actually a medical doctor. Mm-hmm. And there's a statement he makes, Sherlock Holmes say, which I think is really, really important for persons to understand. And, he says that never theorize before you have data. Mm-hmm. Invariably, you will end up twisting facts to suit your theories instead of your theories to suit the facts. Mm-hmm. So essentially, what you have done and what many other persons have done, which is great, is you have sought out facts. Mm-hmm. You didn't make up a theory and then say, well, let me now sugarcoat and find a few things. And then see, I told you, see, you said, no, let me get the information and then I'll come up with a theory. And so I think that's very, very important. So the first thing persons need to understand is, from my own experience, I started residency in New York in July 2017. At that time, there was one of the peak episodes of the influenza epidemic. So we had a really high case burden in 2017, 2018, right? At that time we came in, we were fresh, young, the term they use is interns, your first year resident. And it was a lot of patients coming in, a lot of patients, right? We had to open up, or the administration opened up areas in the hospital to facilitate the amount of patients that were coming in because of the flu. Now I'm going to tell you what happened with coronavirus. There was there was one, maybe two beds The entire hospital was almost coronavirus. Almost every single bed.
Wow.
The hospital working is in Manhattan. And we were the heaviest to be hit. One of the heaviest hospitals to be hit was Elmhurst Hospital, right? And our hospital, we went from having maybe about an 18 to 20 bed ICU, and it just exploded to the point where we had ICU set up where ICU usually isn't. We brought ventilators in. There were more doctors that were brought in, more nurses, more respiratory therapists. So for someone who does not have that experience to now look at me and say, all of this thing is fake, I say, okay. But I saw and I experienced and I had to take care of these patients. So either you want to disregard my own experience and what I saw and listen to someone else who has not been involved in it, who was not caring for these patients, or you want to say, hey, this thing was real. And I'm telling you, I swear by Allah, this thing was more than real, okay? The amount of patients that came to the hospital, the amount of ICU beds, the amount of ventilators, the amount of increase in nursing staff, medical staff, respiratory therapy staff. This was not a hoax. This was real.
Now, when especially amongst the Black community, as I mentioned before, there is actually just an absurd amount of misinformation. One of the these video clips that somebody had sent me was from I'm sorry, man, these Black charlatans, Young Pharaoh. So Young Pharaoh, I'm sorry, like, I don't know how else to say it. I don't understand why these guys are like legit charlatans, man. They're like, anyway, he drives up to, I think it was same hospital you mentioned, Elmhurst Hospital, and he goes outside and you see, nobody's here. Nobody is here. Look at these tents. They're empty. Nobody's here. What is this pandemic? This pandemic is fake. They're lying to you. This misinformation is being spread like rapidly throughout the Black community. And I had one guy, actually, he's Muslim, okay? He told me that this is proof that the Saudi scholars have been misinformed about the coronavirus, and therefore they're making fatwa based on erroneous information, something at that level. And I just asked him one question: you cannot be serious. You cannot be serious, right? So my question, and he blocked me for that. Legit, they're making wala wa bara over these issues. You know what I'm saying? So, like I said, for me, I'm just a simple guy. Like, if something happens, I'm just going to ask the simple, small questions. I'm not going to go to the complicated questions, you know? So the simple, small questions I would ask, okay, they're saying the epicenter is in New York. What are the New York doctors saying? So what would you like to say to the Black community, who are, especially the ones who are being affected by this false information?
All right, so firstly, I think what is important for us to understand is there is a high level of mistrust amongst Black people when it relates to the medical system. And for us to not analyze the history of where that mistrust came from is for us to do a disservice. When we look at the history of the medical system in the United States of America, what we find is that the social construct that was racism affected not just the economical system, but it affected the medical system. And so what I'd like to do is go through a few key dates and events that occurred so people have a firm understanding of why there is mistrust and why I cannot wrong anyone who has a mistrust of the medical system. I can't say, how can you mistrust us? How can you? No, they have every single right to mistrust based on the history. But what they have to keep in mind is the mistrust can also now further worsen what's happening to our community, and it is. And so it is important, every single one of us, it is important for us to analyze why there is mistrust and how we can fix it. So we look at, let's take it from, 1865. There is the 13th Amendment, there's abolishment of slavery, right? Now, in 1847, the American Medical Association, who is essentially the mouthpiece for the practice of medicine in the United States of America, right, is essentially legislated, and they are established. So in 1847, the American Medical Association essentially was established, and their aim was to be the mouthpiece, to be the advocates for how medicine is practiced in the United States. At that time, African-American Black doctors could not join, could not be members, right? So now you have an establishment that's looking at how medicine is practiced that systematically excluded members of the population based on the social construct of how they look. And that's the reality. As a result, there was a response in 1895. A group of 12 Black doctors formed the National Medical Association. And one of their key paradigm was that healthcare was not a privilege, but a right. And that's what we're hearing nowadays, not realizing that came from the NMA. That did not come from the AMA. That's the reality, right? In 1910, so even before that, there was the establishment of historically Black colleges and universities, right? Howard was established, Meharry in Nashville, Tennessee, and a few other institutions, because now you have freed slaves after 1865 who need to get medical care, and you need to find somewhere, essentially, or a means by which they're going to be cared for. These institutions and hospitals and clinics that were established were poorly funded. They didn't have enough assistance, right? And so now you have a situation where people are going to go for help, or they're going to go somewhere for training, and they're just not going to be able to have what's standard or quality care. Now, in 1910, the American Medical Association, then there was a guy by the name of Abraham Flexner, I believe is his name. Abraham Flexner was authorized to go throughout the US and Canada and find the institutions that do not have quality medical training. Guess what that meant?
It's going to the Black ones, right?
They closed every single Black institution except for two.
Wow.
Howard University and Meharry.
Wow, that is very big, very big.
It led to the closing, because now you have a policy paper saying all of these Black institutions, they're not up to standard. You have these doctors that they're essentially they're quacks. And when that information gets out into the community, not only does the community not trust the establishment, they don't trust their own doctors. You guys are quacks, man.
Wow, that's crazy,
listen to you.
Man.
So now this is deep-seated antitrust at the structure of medicine, and doctors who have their own complexion. I don't trust you, man. What are you talking about?
Yeah.
But Howard and Meharry, thankfully, were able to survive. And essentially now, when you look throughout the history of medicine, there are things that have been done to people of color, to Black people, that is inexcusable.
Yes.
And the one that comes to mind is the
Yes.
Yes.
Yes. Yes. Yes, I love you. Yes. 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 Yes, only you.